This video will cover essential information regarding malaria, a critical topic for nursing exams, including NORCET, RRB, ESIC, and DHS. As Dr. APJ Abdul Kalam stated, small aim is a crime. Have great aim. Let this inspire your study goals. Malaria is a protozoal disease caused by the genus Plasmodium and transmitted by the infected female Anopheles mosquito. It's characterized by fever with chills, anemia, and splenomegaly. Historically, the name means bad air. The epidemiological triad of malaria involves the agent, which is the Plasmodium parasite, the host, which are humans, and the vector, the female Anopheles mosquito. The environment, like the rainy season, favors mosquito breeding. There are 5 Plasmodium species causing human malaria. P. vivax is the most common in India. P. falciparum is the most fatal, causing malignant tertian malaria and cerebral malaria. P. malaria causes quartan malaria, and P. ovale is rare in India. P. knowlesi is a recent zoonotic addition. The most common mode of transmission is vector-borne, via the female Anopheles bite. Other modes include vertical transmission from mother to fetus, blood transfusions, and contaminated needles. The Plasmodium life cycle requires 2 hosts. Humans are the intermediate host where the asexual cycle or schizogony occurs. The mosquito is the definitive host where the sexual cycle or sporogony occurs. The pre-erythrocytic schizogony occurs in the liver. Sporozoites are injected by the mosquito, reach the liver, and multiply into merozoites. This stage is asymptomatic. The erythrocytic schizogony occurs in red blood cells. Merozoites attack RBCs, progressing from trophozoite to schizont. Their rupture releases toxins that cause the fever and chills characteristic of malaria. Relapse, seen in P. vivax and P. ovale, is caused by dormant sporozoites in the liver called hypnozoites. Radical cure with primaquine is required to kill these hypnozoites and prevent relapse. The vector, the female Anopheles mosquito, is a night biter. It breeds in clean water and sits at a 45-degree angle. Key species in India include A. calicifacies and A. stephensi. Incubation periods vary by species. Here are some quick facts. The infective form for man is the sporozoite. The dormant liver stage is the hypnozoite. Anopheles breeds in clean water, and P. falciparum causes the most fatal malaria. A typical malaria attack has a classic triad of stages. The cold stage involves intense shivering. The hot stage includes high fever and headache. The attack concludes with the sweating stage, where temperature drops and the patient feels exhausted. Complications, mainly due to P. falciparum, include cerebral malaria, severe anemia, blackwater fever causing dark urine, hypoglycemia, and ARDS. Blackwater fever is a serious complication involving massive hemolysis. Key symptoms are high fever, jaundice, and hemoglobinuria, which leads to dark urine and potential renal failure. Diagnosis relies on microscopy, the gold standard. A thick smear detects the presence of the parasite, while a thin smear identifies the specific species. JSB, or Guillain-Barré stain, are commonly used. Rapid diagnostic tests, or RDTs, are used in the field to detect antigens like HRP2 for P. falciparum and PLDH for all species, providing results quickly. The infective form for man is the sporozoite. The most fatal malaria is caused by Plasmodium falciparum. Antimalarial drugs include blood schizonticides like chloroquine, tissue schizonticides like primaquine for radical cure, and gametocyticides, also primaquine, to prevent transmission. Primaquine is contraindicated in pregnancy, infants, and G6PD deficiency. The standard treatment for P. vivax, according to NVBDCP guidelines, is chloroquine plus primaquine. For P. falciparum, we use artemisinin-based combination therapy, or ACT, typically artesunate, plus sulfadoxine pyrimethamine, plus a single dose of primaquine as a gametocyticide. ACT blister packs are color-coded based on the patient's age and weight. Treating pregnant women requires caution. For P. vivax, only chloroquine is given. For P. falciparum, quinine is used in the first trimester, and ACT in the second and third trimesters. Primaquine is avoided. Severe malaria is a medical emergency. The drug of choice is IV artesunate, with IV quinine as an alternative, while monitoring for hypoglycemia and hypotension. The drug of choice for radical cure is primaquine. A side effect of quinine is hypoglycemia. The DOC for cerebral malaria is IV artesunate. Anti-larval control methods include chemical agents like taminphos, biological control using larvivorous fish such as gambusia, and environmental source reduction like draining stagnant water. Anti-adult control involves indoor residual spraying, or IRS, using DDT or malathion, and space spraying or fogging with pyrethrum extract during epidemics. Personal protection measures include using long-lasting insecticidal nets, or LLINs, repellents like DEET, wearing long-sleeved clothing, and screening windows. The National Vector-Borne Disease Control Program aims for malaria elimination in India by 2030, monitored by the Annual Parasite Incidence, or API, and the Annual Blood Examination Rate, or ABAR. Gambusia is a commonly used larvivorous fish. Primaquine is contraindicated in G6PD deficiency. The cycle for quartan malaria caused by P. malaria repeats every 72 hours. The community health nurse's role includes performing RDTs, administering radical cure with primaquine, educating the community on dry day, and distributing LLINs. Cerebral malaria is caused by P. falciparum. Thick smears are for parasite detection, and thin smears are for species identification. P. knowlesi is the 5th human malaria species. In summary, the vector is the female Anopheles. The infective stage is the sporozoite. Diagnosis uses smears and RDTs. Treatment for Vivax is CQ plus PQ, and for falciparum is ACT plus primaquine. Remember, no primaquine during pregnancy. The difference between ordinary and extraordinary is that little extra effort in your preparation. The information presented is based on references including Park's Textbook of Preventative and Social Medicine and NVBDCP and WHO guidelines. The information presented is based on references including Park's Textbook of Preventative and Social Medicine and NVBDCP and WHO guidelines. Thank you for watching. All the best for your exams.